Healthcare IT Today. I'm John Lynn, together with a special guest host, Michelle Moran from HC Tech. The world of technology and healthcare are ever-changing in new and novel ways, and that's why we love this stuff. So join us as we discuss the latest healthcare and health IT news, meshed together in new ways, which help generate ideas and new perspectives. Plus, we'll have a little fun along the way. Today, we're going to be talking about solving real CIO challenges, and today's episode is sponsored by HC Tech, your partner for proactive, comprehensive healthcare IT services that empower your organization to optimize operations, mitigate risk, and focus on what matters most, patient care. Learn more about HC Tech and their comprehensive healthcare IT solutions at HC Tech, that's hctec.com. Be sure to follow the show on social media at the hashtag HITSM and my personal account at TechGuy and the HC Tech account at HCTECTN. Plus, check out our 18 years of health IT blog content at healthcareittoday.com. Welcome, Michelle.
Thank you so much, John.
Yeah, I'm excited to dive in. There's so much happening in health IT. We've seen a huge evolution of the demands on the CIO. So I'm really excited to have this conversation with you. But talk to me, I think one of the challenges for a CIO today is understanding the various brands as they evolve. Some are being acquired, some have new leadership, all of these different things. What do you think it takes to ensure your brand is kind of consistent across all your employees and really understood by your customers?
Oh, it's a great question. And it's a really important question because, to your point, CIOs have to make big decisions every single day that affect their entire organization along with the patients and the reason we exist in healthcare, right? So I think it's really important to be consistent, to tell stories about how we solve problems, and be very intentional. Know what space you're good at and stick to that. Don't deviate. Don't try to be everything to everybody, but choose the brand, choose where you're going to spend your time and money, and be the best at it.
I think that's one of the challenges when I think of the CIOs that I talk to, and we're here at the Chime conference full of CIOs, lots of interesting conversations. I think many times I've heard them say, well, who is that company now, right? Because maybe before they were their go-live partner and they knew them really well because they eat, slept, and breathed the EHR implementation. But now maybe leadership's turned over, or maybe, the consultant that they worked with or the person that advised them is no longer there. And they're like, well, who are they? Who's at the heart of that organization? And I think that makes it challenging for a CIO. And so, it makes sense why they often go back to the same people they know, even if they switch companies, which is, I think, one of the challenges, for healthcare IT companies like HC Tech.
For sure. So, to your point, I think people still work with people they trust. And so it's important to listen and understand what the strategy is so that you know exactly where you can plug in and help out. And the way you can talk about that is tell real life stories. Here's what we did for so-and-so healthcare, and it solved this issue. But also that proactive part, here's what we're seeing out there, here are the trends. Here's what worked, here's what didn't, and here's how we're going to help you along the way. All of those things are really important, and that's why CEOs are really trying to find partners that they can work with long term and not have to second guess, are they good at this or not? So that's why the trust is most important and the relationship building.
Yeah, I mean, it's interesting to think about. We see this cycle in technology all the time. Initially, they start with best of breed, and then they're like, no, I don't want 10 people to work with, right?
That's right.
And you're kind of highlighting that point, right? It's the same is true. Like, I want someone who can do EHR optimization. I want someone who can do strategy. I want someone who can help me with my AI and understand what's happening with AI and how that integrates with my EHR. I want I want someone who can help with my help desk, et cetera, et cetera. I don't want 10 consultants that are all helping me across 10 different domains that I have to refigure out how they work and what our needs are and what our organizational needs are. But, and then I think the other thing that happens is many organizations get pigeonholed. oh, you're the
Yes.
help desk company that just does help desk. And you're
Yes.
like, well, yeah, we do help desk. You know, I talk to a lot of vendors and they're like, yeah, but we also do this, this, and this. And they're like, oh, really? They haven't kept up to date on it.
That's right. That's right. So I'll give you an example
Yeah, I love
where,
it.
we have a client that is very concerned about, service desk security and all of the surfaces that security becomes an issue for a CIO. That's a big issue today. So what technologies are we implementing to protect our clients? Is really an important discussion. We don't sell security, but we do think about how can we make sure that when a bad actor calls into the service desk, that it's not something that's going to impact one of our
It's
partners.
not a point of vulnerability for the CIO.
That's right.
Wow.
That's right. So again, we're not selling security services, but we have both the processes and the tools to make a difference and ensure that we're going to minimize that risk along the way.
I mean, it highlights probably why most CIOs don't want 10 vendors that they're working with, because if you only have one, then you know that, hey, they have the certain security infrastructure associated with all of these things. And I mean, that third-party risk is one of the biggest ones for a healthcare organization today. So if I have 10, well, I'm increasing my risk surface, as my CISO friends like to say, right? The
It's
risk
true.
surface is a lot bigger if I have 10 vendors, but if I have one or two that does 3 or 4 things, then that makes my third-party risk assessment and compliance and security that much better. So that's an interesting point. I hadn't really thought about that too, as far as the CIO looking at service desk. And, a lot of them do outsource their service desk. It makes sense. We've had HC Tech on the program before talking about the value of, that second level service desk, being able to have real experts on the phone. So it makes sense to do that. But then at the same time, you're saying, I'm going to give a third party essentially massive access to my most expensive system, my EHR,
Yes.
with all of the data that could be breached. It's like
Yes.
that's a big trust that we're talking about there.
That's absolutely right. And so that's why it's important for us to be able to articulate, here are the certifications that we have. Here's how we train our team. This is what we've been able to create for other organizations that worked, and then assess the data, along the way for their specific environment. Every partner / client is unique.
Sure.
And so it's really important that you're able to react that in the right way on their behalf. At the same time, I think as a partner, they want to know, the CIOs want to know that we're investing in the right places and keep them on that leading edge, and go on that journey with them and be very, very specific about where you can plug in effectively and where you are not able to plug in. And maybe you bring someone else in who does that job well.
Interesting. Yeah, I think one of the key attributes we've talked about of a consulting company, a partner to these, healthcare organizations, of course, is having the breadth that we talked about. But another key attribute for me when I look at consulting companies, beyond some of the stuff you talked about, trust, of course, it's first, relationship, understanding mission and vision, those things are, that's almost like table stakes to it. But the other one for me that I think is interesting is, how are they approaching the evolution of the IT products that are out there, right? Epic announced that they have 100 AI features that are coming. Okay, am I going to do that in-house? Am I going to partner with a consulting company? How am I going to do this? And do they understand that as a partner, what that's going to mean? And what does that mean to the service desk that we talked about, right? Like, that's going to impact if the AI tool is there and they're not up on it. That, it's moving so quickly, and the AI is being implemented. That's another one for me that to me is a key attribute that the companies, the consulting companies, et cetera, need to have, is the understanding of where are all these products going and being able to support them, whether it's strategically, whether it's support, et cetera.
Yeah, Well, to your point, not everybody's the same and not everybody's ready for all of the different options that AI brings to the table. And one of the things that we just recently learned through our healthcare advisory board, I have 12 CIOs who serve from across the country, very diverse backgrounds, coming to the table talking about AI as an example. And here's what we do, here's what we don't do, taking a conservative approach. And, it's collaborative. And those small group sessions matter. And that type of networking from across the country matters. So again, as partner, making sure that those conversations are taking place and, we're spending our time and showing results as part of the partnership that we have with our clients.
Yeah. No, I think it's interesting. What I think you're highlighting is, a good partner listens.
Yes. Yes.
Because you're right. If you're working with the Mayo Clinic or you're working with a rural, healthcare clinic, sure, some of the needs overlap. Doctors are still, challenging and things like that. But a lot of the things are very different because how much budget they have, how they're approaching to it. Are they innovative and they want to push the envelope, or are they a little more risk averse? And do you need to not push the envelope that way? Do they trust when they call into the service desk, or are they, a little bit arrogant, and when they call in, they think they know everything, right? These are some of the unique attributes that you need to listen to understand, I imagine.
Sure. Culture, budget, the unique needs. It's really important to understand the deliverables, what kind of skill sets, the level of maturity they have within their organization, all of those things so that you can provide the right solution. And, if I heard it once, I heard it at least, 5 times from our advisory board that it is just really important to be relentless about being the best in the area that you plan to serve.
Oh.
So, for us, if we're staffing for someone, we really want to understand exactly what that skill set needs to be so that we can make the right match. The good news is that we're hiring a lot of the same skill sets for service desk, for application managed services, clinical service desk, MyChart service desk, whatever it might be. So, we stay in tune to that all the time.
That's interesting. What a great insight. If you're going to do it, be the very best at what you do.
That's right.
Because that's what they expect, and that's what the patients deserve too.
Right.
But as a CIO leader, it makes sense why they would push that forward. Fascinating.
I also think that CIOs are looking for partners. They understand that we're dealing with humans every single day, right? So mistakes are going to happen.
Yeah.
And so as a partner, are you going to jump in with urgency and do your best to solve it together? That's what they're looking for.
Interesting.
That urgency and resourcefulness, working side by side with them on that journey to resolve whatever the issue might be. Because what if there is a breach?
That's a good point. You need a good partner when that happens. That's for sure.
That's right.
Interesting. Well, if you're just tuning in, you're listening to Healthcare IT Today with John Lynn and special guest host Michelle Moran. I want to take a moment to thank our sponsor, HC Tech. Are you ready to start empowering your patients and clinicians? HC Tech partners with healthcare IT leaders to provide unparalleled talent and expertise. By leveraging their deep healthcare experience, proactive approach, and comprehensive solutions, they empower hospitals and health systems to optimize operations, mitigate risk, and focus on what matters most, patient care. To learn more about HC Tech solutions for your health system, visit HC Tech, that's hctec.com. Well, Michelle, I mean, you talked about your advisory board. It sounds like your ears to the ground. I think that's what people don't understand how many CIOs you probably talk to. You probably have a really interesting perspective on some of the biggest challenges and problems that you're hearing from these healthcare IT leaders and what can be done to address them. What would you say are some of the top things you're hearing?
Well, there's a lot of integration taking place and consolidation within healthcare. When you think about you've got Cerner and Epic, the market share changes. That means different skill sets. That means planning. And, when you talk about mitigating risk, understanding what could happen. And so I think, what we hear from the CIOs is they really need to have the right staff. They need to be able to bring their staff along with them when those changes are taking place, but also keep in perspective that they're serving the departments that they work with, the clinicians, but ultimately the patients along the way. So they want that whole package. And it's not easy because they have a budget. It's not, they don't have unlimited money to spend. And especially today, that's a challenge.
Yeah, that's fair. And I think there is a bit of have and have nots in healthcare, but even the haves seem to hoard their money. I don't understand that completely either. But I think what's fascinating, for me, when I look at it, I say the biggest thing I see people working on, CIOs, is application rationalization.
Yes.
They had this explosion of applications where they implemented 7 different communication systems, and they now have 4 EHRs because they acquired, and they're like, what are they gonna do? How do I get this down? I had one CIO come up to me, he's like, John, we were at 500 applications. We're down to 300 and we're gonna make it to 2.
Nice, yeah.
I was like, see, he cared, right? And he knew the value of simplifying the number of systems that they're on because it was so important to them. And so he made that a priority.
Yeah, as it should be. Because if you think about how taxing that is on his employees, that's part of the equation too, is how can you manage that along the way? So, the other piece is, for example, healthcare system is migrating to Epic, but they don't have an inherent Epic team in place.
That's a big deal.
It is a very big deal.
Retraining is tough.
Yeah, so and adoption. You spend millions of dollars to put this program in place, and you have to have the adoption in a very short period of time. So how can you plan for that? You choose a partner that can help you get there. And both short-term and long-term. Not just the migration, but understanding the ecosystem that they're dealing within.
Yeah. I think one of the other challenges that I hear from CIOs is there's too much opportunity.
Yes.
And so it's just prioritizing the opportunities. A lot of them are going big in ambient clinical voice, AI medical scribes, which makes sense. There's so much value there. But there's also some that are really skeptical, like what's the ROI of this? Is it an expense? How is this going to evolve? Not to mention, who is the right one? Am I picking the right pony, right? Because if I choose the wrong pony, now I have what you just described, which is I have to switch from one AI medical scribe to another. That's going to be an interesting thing. I mean, we saw this with EHR. Many of them chose the wrong one. Now they had to switch, right? It's the same thing happening again. But I think even going beyond that is okay, what other AI tools should I be doing? There's so much happening. How do I stay focused? And most of them tell me, let's go back to the strategic goals.
That's right.
And ironically, one of the biggest strategic things that they could do is actually not the AI sexy stuff that you hear at conferences. It's can I optimize my EHR? Could I add another template or another checkbox or another drop-down menu to make that doctor's life, 10% easier every day? And it's that's such a mundane thing, but it has such a big impact. And many, I hear this from a lot of CIOs. Sure, AI is great, and I need to keep up on it because I don't want to get left behind. But EHR optimization is going to actually give me the most bang for my buck.
That's right, because the clinicians use it every single day. So, giving the clinicians access to the information that they need and the training that they need on an immediate basis so they can keep doing what they need to do is critical.
I think it's interesting because you probably talk to a lot of CIOs about this. Is there any organization that couldn't benefit from EHR optimization? My feeling is no, no one's optimized it completely. It's kind of like the RCM vendors. They go in, they're like, give me any company, any organization, their RCM is going to be off. I'll go find 5 million. And I'm like, really? And they're like, yeah, we do that all the time. The other day. I feel like the same is true with EMR. You could go into any of them and you could find optimization opportunities.
Yes.
Is that what you see?
Absolutely. And, I'll tell you that we've helped organizations go from, 5 gold stars to 10 in the epic space.
Right.
And it's all about, it takes time. It takes intentional focus, and it takes those skill sets, and both internally and externally, to make that happen. But when you do and you achieve it, there are a couple things that happen.
Okay.
Their employees become much more confident. The adoption is at a higher level. They know they're maximizing the cost that they're spending on the platform. And in the end, it's not as taxing on their team if they outsource it. So,
Interesting.
and they have the right partner to do that with.
Huh.
So we've done that several times with our partners, and very proud of that. But we're also, we also understand that everybody has different models. So whether it's us placing people and training, or it's us doing the work for them, the bottom line is that we understand the whole ecosystem, which, from a partnership perspective, brings value to that CIO.
Yeah, absolutely. And I think what's beautiful is that this isn't about shaming them. Like, there's a lot of really reasonable reasons why they haven't optimized. Whether it was we were doing it in the implementation, but we had to cut it because we had to meet a timeline.
That's right.
And they just never came back to it, or someone was fired, or left the company, whatever. They had a change of staff. There's like hundreds of reasons. It's not about, oh, you're a bad leader, you didn't get to this. It's like, no, in an EHR implementation, there's thousands of things to do, and you had to cut something because of different timelines or whatever it might be. So I think that's the other interesting. And then probably the other part is to your point, which is, do you have the right staff to be able to do that?
That's right.
Do they have the expertise to optimize? In fact, I think that's one of the other big questions for CIOs is around staffing. Can they find the right people? In some cities, yeah, they probably have a plethora of people that they can get. In a lot of cities, I live in Las Vegas, there's not a lot of people. There's not a lot of health IT professionals there. And so, it's a different discussion.
It is a very different discussion. Geography matters.
Yeah. But I think there's
access.
also other things like security, right? We see that when it comes to staffing, finding good security professionals who understand how to do healthcare and that we can pay, because we don't pay as much generally. I think that's part of that other staffing challenge. I'm sure you hear a lot of staffing challenges when you talk to CIOs. What do you hear?
Absolutely. So sometimes what we hear is, we want someone who can do these 3 things. And normally in the marketplace, we've got 2 out of the 3. But that 3 makes it a unicorn. And so, those conversations have to take place around, we'll do our best to find that. But here's what you're really going to find. And really explaining, here's why this is a better scenario for you. Because in the long run, you're going to get more out of this person to contribute to your staff.
So you have to have that honest conversation. It's like, guess what? That doesn't exist.
Yeah.
Unicorns are nice,
That's right.
but they don't exist.
Yeah. We'll go do it. The 30 days. What's your time frame? We'll go look for it. But when we know that it's rare, it becomes more advisory for us because we have seen all the trends and can show them the data.
Interesting. So, I think there's probably a message here that CIOs have to be flexible because sometimes you just can't find, especially in certain areas, that someone that wants to do that and has the skills and expertise to be able to do it. Yeah. I think the other one that's interesting, and I love talking to CIOs about this, is how are they retaining staff? It turns out in the EHR world in particular, they're getting paid a ton of money to do that work. And so, retaining staff is so important. So how do they create the culture that makes people want to stay? And what I've found is that, like you said, it's whether it's going for that epic, 10-star gold stars, or whether you're going for the Chime most wired, or, whatever it is you're going for, showing that makes other people say, oh, look at us. We're a high achieving organization. Do I want to go to a 5-star? Maybe there's some people who like that challenge, but a lot of people, the best ones, are like, no, let's do the high performing and let's take it to the next level.
That's right. It's that pride factor of belonging to a team, being part of the strategy and contributing, and knowing that you have this path for your career and that, they're going to invest in you. It's not always more PTO. It's about that pride factor and showing the contribution along the way. So,
well, and most of them are pretty well paid anyways. You know, you're not going to get massively rich working IT in healthcare, but they get paid well. You know, I heard an interesting study one time that said once you go past, I think it was like $60,000, and there's probably inflation, so it's probably 70 or 80 now. You don't get as much satisfaction out of the dollars as other things, because you have that base of what you need to live. I'm sure New York's more like 110, but you get the idea. And I thought it was fascinating. And so I hear a lot of, you know, CIOs saying, how can I do those other things that make satisfaction? I was reading on the flight here just about an interesting CIO who you know, he was working with a guy, and the guy found out he had his daughter during the Christmas break, from Christmas to New Year's, but he had to work. And he's like, what does he do?
yeah.
And the CIO went to him and said, just take it off. Go be with your daughter. Like, sure, could he have worked, and could he have said, no, you have to work, it's your hours, you don't have vacation time, whatever? Yeah. No, but he understood his daughter mattered more. Now, how, you know, that person was so indebted to him for caring about him and his family.
Sure.
And so it's, you know, sometimes I think we need to think about that more.
Oh, I think so too. I think giving back in a meaningful way like that. I think the other thing that I see CIOs doing is, especially when they get more mature in their career, it's about, how do I give back to the community? How do I give back to this vertical? And, you know, that was one of the questions we asked our advisory board. We asked them about their CIO journey and how do you want to give back? And it was various organizations and or building their teams up, that succession planning, you know, because people want to work in an environment where they know they can thrive and they can see that next step. And they're contributing to something that's meaningful. That's important.
Awesome. Well, and it should be in healthcare. Well, Michelle, we're all out of time. I appreciate you coming on the show and guest hosting with me. And thanks everyone for tuning in to this episode of Healthcare IT Today. I want to thank HC Tech for sponsoring today's episode. You can learn more about HC Tech and their comprehensive healthcare IT solutions by visiting hctech.com. That's hctec.com. And to find out more details about our show, check out our programs page on healthcarenowradio.com and share your voice and engage with the community at healthcareittoday.com and on Twitter using the hashtag HITSM. I'm John Lynn with special guest host Michelle Moran. Thanks for listening and have a great week.